My name is Randy Aldridge. I'm here today to help Coastal Horizons as they mark 50 years of service to the Cape Fear area, really the state as a whole. It's a big deal. They do so much for so many people. Today, we are talking specifically about the Rape Crisis Center, and I want to introduce these two people you see right here on our screen. Let's start with you. This is Chelsea Croom. She is the Rape Crisis Center Supervisor. Hi, Chelsea. Good to see you.
Good to see you. How are you?
I'm good now. A little tech issue here, and I know nothing about it, so I had to bring in the big dogs. Real quick, Chelsea, let's talk about what you do. I want to get an umbrella of all the stuff that you do, because I know you're very busy. We've talked once before, and I'm really anxious to hear more about it.
Yeah, so specifically at the Rape Crisis Center, I'm the supervisor for 4 counties. So we're in Duplin, Brunswick, Pender, and New Hanover counties. So I oversee the day-to-day. We have 4 advocates and 4 therapists. All of our services are free and confidential. We respond to the hospital. We have a 24-hour crisis line. And then we also do rape prevention education, which is what we're going to be talking a little bit about today with Janie. And yeah, that's kind of the bare bones of what we do.
We're going to get into a lot more of that, but let's talk with Janie right now. Janie, you're in charge of education. We talked really briefly about this yesterday. I'm fascinated by this. Tell everybody what your role is.
So I'm Janie. My role is Rape Prevention Education Coordinator, which basically is RPE, which is Rape Prevention Education, and we do primary prevention strategies in the school system to help prevent sexual violence.
A big job, goes without saying. That's very important. Chelsea, let's come back to you. Let's kind of start to talk about what the Rape Crisis Center does. I know that you get involved on many different levels, but let's talk about how when somebody presents, like at a hospital or contacts you, and say they've been a victim of sexual assault. I know that word sexual assault is a big word, so maybe you can let us know what that means, and then what your first steps are when you get involved.
So first, we get called from the hospital a lot of the time if someone has presented that they've been sexually assaulted, and then we will dispatch an advocate or a volunteer. We do love our volunteers. And they will go and they kind of sit with the client, with the survivor during the rape kit. We're there really to answer any questions, kind of guide them through it, make them feel a little more comfortable, get them whatever they need, whether that be food, blankets, anything like that. And then, from there, we do advocacy after that. They can come into the office and we can go with them to law enforcement interviews, DA's office interviews. If the charges are taken, then we will go to trial with them. There's a whole lot of stuff that advocacy entails.
Let's talk about that first meeting a little bit. I can't imagine what it must be like for either the sexual assault. We talked about this language to use yesterday. At this point, we like to refer to them as sexual assault survivors, right?
Yeah, I like that term better. It feels more positive.
I agree. So when you go to meet these people, they're obviously in distress.
Yes.
Your volunteers and people who are trained for this. Tell me about what that initial meeting is like. I mean, I imagine there's healthcare professionals around. You walk in, there may be law enforcement there. It must be mortifying for the survivor, but also very confusing for everybody. Can you kind of tell us what that process is like?
It can be. So we go into the emergency room and we're told what room they're in. We go back into the room, and depending on how long they've been there or, what has happened before they got there, there may be law enforcement there and there may be nurses in their room. We go in and we just introduce ourselves. We kind of say, hey, this is, my name is Chelsea. I'm here as an advocate with the Rape Crisis Center. You don't have to use our services if you don't want them. If you don't want me here, I don't have to be here. So it's definitely up to them if they want to have an advocate in the room with them. But most of the time they do. And we sit in that room with them and we talk with them, and we sit through when the law enforcement is in there. We sit through the exam a lot of the time if they want us in there. But again, that's totally up to the survivor.
And I come to this from a zero knowledge level. So I'm going to ask, so once the hospitalization part of this is passed, what comes next? I mean, I can imagine getting out of the hospital, heading home must be also traumatic. I really can't imagine what this is like. So can you tell us how you help people through that process as well?
Sure. Yeah. So the crisis line is always available. It's a 24/7 line. And so the survivor can always call that line afterwards. But a lot of the time, a lot of the time, every time, we follow up the following day. So we have an advocate that's assigned to that client, and they will call and they follow up. They kind of just make sure, they don't have any other questions. They don't have anything that they need help with as far as like financial assistance or housing or things like that, because we do refer in the community as well. And then we also get them set up if they are interested in it with therapy at the Rape Crisis Center. So that can look like individual therapy, or we also do group therapy as well. So they are able to be a part of that if they want to.
A couple of things you were talking about that I want to touch on. Let's talk about where they go after the hospital. Home may not always be an option.
Mm-hmm. Yeah. What we see a lot of the time is victims of sexual assault, survivors, but in this case, victims of sexual assault, a lot of times are, not in the best financial situation, or not, they have substance abuse, things like that. And that's when we see like a perpetrator is going to perpetrate on victims that are a little bit, not as, I don't want to say strong, but they don't, I can't think of the word, but anyway.
They're in a situation
Isolated.
vulnerable, they're alone.
Vulnerable, that's the word. Yes, sorry. Woo. Yeah, so perpetrators do perpetrate against more vulnerable populations. So a lot of the time when we do meet a client at the hospital, they don't have a home to go to. So what we try to do in that initial visit is to get them set up with in a homeless shelter or with domestic violence shelter, depending on what has happened. We are also able to, for at least one night, depending, we can put them in a hotel for one night if the means are there to do that.
So you do have partnerships with other organizations that help you at this point?
Absolutely, yes.
So you also talked about helping them as an advocate. Does that help them also? Law enforcement's usually, I guess I would assume, always involved at this point.
Depending on if the client wants to move forward with charges.
Okay, well that's an interesting question then. So they present, I've been sexually assaulted, mm-hmm. And so some of them may not press charges. You still stick with them and help them with whatever's happening next, right?
Absolutely. And what I mean by charges is it is a crime no matter what. So they can still, depending on the evidence that's collected and things like that, still charge the person if the victim doesn't want them to. But 9 times out of 10, they're not going to do that because they need the support of the victim to move forward with the case. Also, when someone presents to the hospital, they can do an anonymous kit. And in that case, they don't have to say who the perpetrator was. They don't have to say, anything really about it. They just get the kit done.
Okay, so I guess the next thing is if they do decide to move forward with a legal action, call it that,
yeah.
Do you set them up with legal help as well and help handle, because that must be just as mystifying as any of this, is how they move forward with that?
So it would be the state. So we work with the DA's office. The state would represent them in the case. And so we help them navigate. A lot of times we'll be that person that calls the DA's office to check in and see if there are any meetings coming up or anything like that. And obviously follow up interviews with law enforcement. We will accompany them to that as well.
Okay, I'm going to give you in a minute, Janie, but I got a couple more questions for you, Chelsea. Okay, so sexual assault is a big word, I think.
Mm-hmm.
A lot of things, mm-hmm. Maybe not always resulting in a trip to a hospital. Is that accurate to say?
Yes. So sexual assault, we're called the Rape Crisis Center, but it doesn't mean that it has to have been a rape. Sexual assault is kind of an umbrella term for a multitude of different things. It can be unwanted touching, unwanted advances. It can be, it could be a family member. It could be a husband. There's a lot of different facets to what sexual assault looks like that isn't just rape.
So contacting you can help in things that aren't a hospitalized rape incident. It can be just, I'm in an uncomfortable thing. I need to know how to manage that.
Absolutely. And we don't want to forget either that a lot of times, a lot of our clients come to us and maybe something's happened years ago. It could be something that happened in their childhood, and they come to us when they're 20, 30, 40 years old, and they just want therapy. They want to talk about it. Sometimes they do want to move forward with calling law enforcement and reporting it. A lot of times it's just therapy that we're there for, but it's not just the crisis that we're involved with. We're also very much involved in, support years down the line.
I think that's fascinating because my knowledge of this very much comes from Law and Order SVU. So, and I think many people are like me. We just don't, if you're not involved in this, you don't know. So it's interesting to know that people who are way past the actual initial incident still need help. They still need to know what to do, and they still need to find a place that helps them find that help, right?
Absolutely, yes.
Well, let's go over to you, Janie, because I think that leads into you with education. And we talked about this just a little bit yesterday. And you go into schools and you start talking to kids, boys and girls, at a very early point. Let's talk about what you do as early as possible to get involved in students and in the community's life. Let's talk about that. Janie, can you hear me?
She's frozen.
Oh, last part you said. Where are you going? Can you hear me?
Yes.
I can hear you.
How about now? Good.
Can you hear me?
Good. Yeah, I can.
Okay. Oh, Janie,
Yes.
what we were saying, we just came out of a great question with Chelsea about educating people about what you guys do. And I know you get involved with students. We talked about this a little bit yesterday. I think really at a great age, very young. Tell us about what you do and when it starts and how you begin to get involved with the community and specifically with young people.
Yeah, so RPE, Rape Prevention Education, is a program that's throughout the state of North Carolina. We've had the grant for years at RCC, and it's funded through the CDC, through North Carolina's Department of Health and Human Services. But what RPE is all about primary prevention. So stopping the violence before it even occurs, meaning stopping the violence before perpetration occurs, before victimization occurs. So meaning getting to the youth, getting to the kids at a younger age when they're starting to develop those behaviors, those attitudes, so that you teach them about boundaries and teach them about other people have boundaries, so that they understand when it's wrong to overstep someone's boundaries. So with the programs that we do shifting boundaries in 6th grade. So that starts at 11 years old. And we're in go ahead.
This is boys and girls.
Mm-hmm. Yes, we do not separate them. We keep them all in. We do it through health class. So I communicate with a lot of the PE health coaches in the middle schools, but yeah, they're all in the same classroom together.
At that age, what is the language that you use with an 11-year-old? Because clearly that would be different than people who are adults. But I know it's a very difficult situation to put it into terms they can understand, but also scaring them or making them overly concerned. You want to get them to know what's going on, but also talk about it, right?
Yeah, so we don't really change the language. We talk to them like they're a 6th grade student. They're in middle school. They're an adult. They're getting there. And we in the actual program, we talk about boundaries. We talk about the New Hanover County Schools Title IX policy. We give it to them the way that they need to know, because they need to understand that this policy is there to protect them, and also own the responsibility that we take it seriously. Go ahead.
What is the Title IX program before you go on?
Yeah, so the Title IX policy is the sexual harassment policy for New Hanover County Schools. And it's just all about discrimination, bullying, and sexual harassment in the schools and how it should not occur. And if it does, you can file a report on it.
How do the kids react to this? I know we're going to get on to, you do education.
Yeah.
But how do they react to this?
So I've been in RPE for 3 years, and I've taught a lot of 6th grade classrooms, and they laugh. They think it's silly. They're awkward. They're uncomfortable, but they also respect that we're talking about these uncomfortable topics, and we're in there talking about something that's like everyday life, and they give us respect for that, and they ask serious questions, and they really get into the program.
When you're talking to them, do you tell them the chain of if something does happen, like who do you go to first? Do you get involved in that? I don't the only thing is chain of command. I know that's not the right thing, but there are you teach them about. Tell me about that.
Yeah, so the sessions are just 4 sessions long, so it's not a long program, about 45 minutes each. And the first sessions, they start about boundaries. We go in there and we kind of introduce ourselves because these kids are wondering, why are you in here talking about this stuff? And then it kind of leads into flirting versus not flirting and going too far, like harassment. Watch a really awkward video that's funny and old, but to the point. And then we get into the Title IX policy around what their school has in policy that protects them in their school environment. And then we go even further into some activities and talk about what a report looks like, where it is, how to find it, who are the trusted adults, who are the guidance counselors in your school. And then we go even further in the last session as in doing hotspot mapping, which is we basically give them like a general map of their school, and they get to color where they feel safe and where they feel unsafe. And we collect that data and give it back to the schools.
Okay, lots of questions.
Yeah.
It's a long time since I was in 6th grade. You said flirting versus not flirting. I think the lines of that they're blurry for me. It must be a very difficult thing to show these kids what is acceptable and what is not, or maybe it's simple. Can you tell us more about that?
It's, I mean, I've noticed that it's very simple the way the curriculum is laid out, because it starts talking about boundaries, and a lot of kids don't know that other people have boundaries, and you have boundaries with different people at different times in different areas. So it kind of leads into that. And then we do an activity around like personal space, like measuring personal space, which leads into, okay, you're getting older, you're going to start developing feelings towards someone, and then that can lead to flirting, but also it can lead to flirting and going too far. How do you read that?
Okay, so when you're talking to these kids, it's not just about how to respond if something's happened to you. If I get this right, you're also showing them how to interact in a sexually aggressive behavior, correct?
Mm-hmm.
It's not just don't let this happen to you, it's also don't do this to others.
Yeah, it's not a scare tactic. It's just kind of like, hey, these are boundaries. We all have them, and you might cross them one day. What does it look like?
All right. So you also do more than school-age children and 11-year-olds. Let's talk about more education programs.
Yes. So RPE scope of work also is a parents caregiver workshop that we do in the community. It is called Birds, Bees, and Sexting, and it's all about kind of updating the talk that we all grew up having, and just trying to explain to like parents and guardians and caregivers that it's okay to have that knowledge built over time, and to have those conversations and those little teachable moments throughout childhood, so that when you get to puberty, when you get to those very uncomfortable topics, you've already built that backbone of what sexual health looks like, what body autonomy looks like, and everything in between.
Because for parents, it can be an uncomfortable conversation as well to have. You're giving them the tools to speak to their own children or their children that they're in charge of, so that everybody is healthy and in the same place.
Mm-hmm. Yeah. So in the workshop, we provide a lot of resources around like books and different online resources. We just kind of open it up as a discussion, because everyone has different family values. We all come from different family makeup, so it's just kind of an open discussion, and make parents know that they're not alone.
What about education after school-age kids? Are there education programs for the general public, and do you do other programs like that?
Yeah, so the biggest part is Birds, Bees, and Sexting and shifting boundaries. That's the biggest part of my job. But we also have like community outreach. We have bar outreach, where we do lots of fun swag bags and drop off consent messaging and other materials to the bars and communities out there. We also have a high school curriculum that we're trying to introduce, that we're we are working with the schools and contracted with them on introducing a 9th grade curriculum about bystander intervention. There's also a lot of committees and meetings that I go to with community partners and doing other programs. So just trying to get out into the community and do as much out of the box work as possible for prevention education.
And something I might have should have asked earlier, when you're in schools, are you partnering with the counselors in the school?
So in Shifting Boundaries, we started outside just kind of getting to know the teachers in individual schools. But as of last year, we're in all the middle schools, thanks to Title IX review committee with New Hanover County Schools. We got to be a part of that and worked with the school administration, and we're able to actually get the Shifting Boundaries program in all the schools. And that was through actually having the PE coaches trained in Shifting Boundaries, and they now implement the program in the schools with my help. So
awesome. I want to get back to you for a minute, Chelsea. Something the Cape Fear area and really the country has had to deal with is the opioid crisis. And I'm kind of wondering, I don't want to lump these together, but does the opioid crisis impact you disproportionately? Are you dealing with that as well as what you're doing in the rape crisis on a regular basis?
I think I kind of hit on it earlier. Obviously, a more vulnerable population is going to be subject to more violence, and that doesn't have to just be sexual violence. So I don't think specifically to the opioid epidemic, we are seeing, an uptick, but I do think that substance use definitely plays a part in both perpetration and victimization.
A couple of more things for you. This is men and women. Men present, or if they do, is there a difference? Do you do things differently?
We don't, no. We literally let anybody come into that office that needs our help. We start by believing, we start by listening. Doesn't matter if you are straight, gay, a member of the LGBTQ community, Black, white, anything, male, female, you can come in there and get our services, and we treat everybody exactly the same. We meet you where you are, and what you need is what we're going to try and deliver.
When we talked yesterday briefly, you mentioned that yes, you do also do outreach with the LGBTQ community as part of what you do, which is great. Is there anything special that you can want to make sure the LGBTQ community knows about the Rape Crisis Center?
So we do, part of our funding, we do have underserved funding. And so what that looks like is we have 2 victim advocates that specifically work with an underserved population. And one of those underserved populations is the LGBTQ community. And something that we really pride ourselves, I'm going to give a shout out, she's not on here, but Kara Schaefer is our LGBTQ advocate. And she has just done a rock star job of getting us out in the community and doing safe zone trainings and training the community and making sure that the staff at RCC, that we're trained and that we are sensitive to LGBTQ people.
That's wonderful. And I think it's great because you've said what I wanted you to say. You really, anybody who needs it are there, and you have protocols in place to help everyone.
Absolutely. Absolutely.
Okay, we have to talk about this because we are in the middle of a pandemic. I'm going to start with you, Chelsea. I mean, it has changed everyone's lives. We're going on almost an entire year of it at this point. Let's talk about how you guys have shifted gears and maybe kind of replaced yourself. And what have you done? I imagine it's still evolving over the past several months, but tell us how the pandemic's affected you and what you guys are doing. And then we'll do the same thing with you, Jane.
So we actually are working from home mostly, or we have been for the majority of the pandemic. And what that really looks like is we're still doing the 24/7 crisis phone. We still are answering that phone. We are still providing advocacy support via telephone or Zoom. And we're starting to filter back in now, but we were doing that primarily via phone or Zoom. And then what we've actually had more engagement with is our therapy groups. And those are online. They are also via Zoom. And then we also still do therapy, and that is via Zoom as well, or phone, whatever a client is comfortable with.
And it hasn't affected you going to hospitals to meet with victims at all?
It has. So we work really closely with our hospitals, and we pride ourselves on that relationship that we've been able to keep. And so we talk very closely with them. I have a really good relationship with the coordinator out there. She did not want us coming into the hospital with all of this going on. So we are providing that support via phone. And we are still following up the day after. So we get the call when somebody does present that they've been sexually assaulted. We can talk to them that night if they want to talk to us. And then moving forward, we would reach out to them the same way we would if we were meeting them in person. We'd reach out the next day and they get all the services the same.
So really no lapse in availability, is just how you're doing it.
Absolutely, yes.
Okay. All right, Janie, let's talk about this. A lot harder to go into a classroom when nobody's there or they're studying from home. How have you switched gears?
Yeah, so there was a bit of a panic in March because can't go in person in schools anymore. But we figured it out really quickly. Our Shifting Boundaries is designed in like a booklet, like a PDF form, and we print that off. So we basically just transitioned that to a digital form and added in different links that relate to the program and sent that out to the teachers. Luckily, the teachers already understood the program and were implementing it. So I think our program got very lucky to be able to finish the year out with the program online and the teachers already understanding the program and the curriculum. But as for this fall, we also had a Google Slides like classroom option. And the schools have like done well. I mean, obviously it's still minimum of students actually doing the curriculum, but it is out there and they are virtually able to get to it. But yeah, no in person yet.
Well, that's the world we're living in. But it sounds like you're still getting your message to these kids.
Yeah, it's still getting out there. It's just a different form. It's virtual. It's the best option that we have right now. And I think it is successful so far. So we're getting there.
So I'm going to put this to both of you because my mother just texted me with this question. She's watching. She goes, she said she wants to know, and I think it's a great question. This is a lot of stuff you offer. You said you had 600 employees, I think, earlier, right, Chelsea?
Yeah, in the whole of Coastal Horizons, yes.
He is asking, do people have to pay for this? Do clients have to pay? How does this work?
No, so we are lucky. We are a nonprofit. Everything is free. Every service that we provide is free and confidential.
Even when you go to the schools, all of that is paid for and everything. Like the school, this is not it's something that the school system pays for. This comes separate.
Program.
Yeah, no, it's all free. Everything we're funded, and then we go out and we deliver our services for free.
And RP is funded through the CDC, and we have money. We're able to implement it. That's my job, so that's free.
That's the best part of all of this, because people will think about that. You're in the hospital, something's happened to you, or not even in the hospital. 40 years later, you're like, I need to talk to somebody. I don't have the money to do that.
Yeah, and that is a question we get a lot of the time when someone calls our crisis line is, well, how much is this going to cost? Do you take my insurance? And it's such a relief when we tell them, we don't need your insurance. We don't care, what your financial ability is, and we're here for free for you.
Oh, that is fantastic. All right, I'm going to ask you a couple of quick questions here. Chelsea, what is the future? What's coming next? I know I hate to ask you to look into a crystal ball, but I'm sure you guys have mapped things out over the next several months. The holidays are coming up. I don't know if that means that you see a busier time. If this is busier for you, I know the holidays can be stressful for a lot of people. You're just kind of block out like the next few months, what's going on, and then maybe look a little further down the road.
Sure. So I will say that I think our crisis line definitely probably gets a little bit more busy over the holidays. There's a lot of stress that comes with being around, family members that may or may not, have believed somebody, or they may even be the perpetrator. There's that kind of thing. So I do think that our phone gets a little bit more busy. There's a lot more support that we're providing via the crisis line. As far as hospital calls, it varies every year. It's a little different every single year. I think personally what I've witnessed is that it does slow down a little bit, but it will pick back up in the beginning of the year after all the holidays have passed.
And real quick, Janie, we're going to wrap things up here real quick. What is your message to people from the Rape Crisis Center?
Message from the Rape Crisis Center, be the askable parent, learn about boundaries, and don't be afraid to say no.
Well, I want to thank both of you for talking with me today. I've got so many more questions. We could have gone on forever. You both are doing a great job. It's been so nice to talk to you, and so honored that you guys asked me to be a part of this. I want to tell everybody that you can also help support the Rape Crisis Center. If somebody wants to donate, that is also a possibility. They can find you through social media and online. There's lots of ways to find. And this is hardly the last forum. There's another one coming up next week. I want to make sure I get this right. It's for the Children's Place, and you focus a lot on the children of incarcerated parents. That's next week with David Crabtree of WRAL. Thank you to both of you, and thanks to everyone at the at Coastal Horizons for all you do. Y'all have a good day.
Thanks.
Shout out to Rape Crisis Center staff. We love you guys.
We do. We love y'all.
All right, bye-bye.
Thanks, Randy.
Bye.